Hello, my name is Seth. I'll be your nurse practitioner today. I'm going to enter the room and wash my hands. Do you consent for me to record this video and put it online for grading purposes?
I consent.
And why are you in the office today? What brings you to see me?
I've had a headache for 2 weeks.
Had a headache for 2 weeks? How often do you have your headaches?
Every day.
How long do they hurt for every day?
Couple hours.
Okay, did you hurt yourself, hit your head, car accident, anything?
No.
Do you have a history of headaches?
No.
Any medical history at all?
No.
Okay, and have you taken any medicine for your headaches?
No.
Does anything make them worse?
No.
Anything make them better?
No.
Okay, so it just hurts every day, 2 hours a day roughly, for 2 weeks now. And you're not allergic to any medicine?
No.
Okay, and you don't take any medicine?
I do not.
And no health history?
No.
All right, well, I think we should do a neurologic exam based off of your headaches. Check out everything with your brain and the brain stem, the cerebellum, your cranial nerves, the spine. Make sure everything's there that could be causing a headache, okay? So the first thing I'm going to start with is I'm going to ask you some silly questions and just answer them for me.
Okay.
What's your name and birthday?
Heather Barney.
What's the
060288.
Perfect. What's the date?
Today's date is May 7th.
And why are you here today?
About my headaches.
Okay. And where were you born? What city?
Opelousas.
Okay. And what day of the week is it?
Sunday.
Awesome. And I didn't ask, what's your pain on a scale of 1 to 10?
When I have the headaches, it's about a 7.
Okay. All right. Well, you seem to be alert and oriented. Your speech is clear and concise and makes sense and is audible. You have long-term memory from your city of birth, as well as recent memory for the reason you're here and the date and stuff. So that all seems good. You're alert and oriented, and that's good. Next, we're going to go through the cranial nerves, all 12 of them. The first one is cranial nerve 1, the olfactory nerve, and this is your sense of smell. So close your eyes for me. I'm going to grab some tools here and cover one nostril, it doesn't matter which, and smell this. What does that smell like?
Orange blossom.
Very good. And close the other nostril for me. And what does that smell like?
Vaseline.
Close enough. Toothpaste.
Sorry.
Close enough. But the olfactory nerve is intact. Next, we're going to do cranial nerve 2, the optic nerve. So I'm going to have a Snellen chart right over here, about 20 feet away from you. And just read this line right here for me.
A, B, C, D.
Perfect. And do the same thing with one eye closed.
E, F, G, H.
Perfect. And would you swap eyes for me and try one more time?
I, J, K, L.
Okay. So we can say you're 20/20, left, right, and bilaterally. Next, we're going to do a peripheral field exam for optic nerve. Just want to make sure that your peripheral fields of vision are okay.
Okay.
So go ahead and close one eye, or cover one eye, I'm sorry. Perfect. And I'm going to move my hand slowly into your field of vision, and you just tell me when you can see it, okay?
Okay. Do I need to look straight?
Oh, yes, of course. Look straight ahead at the wall
Okay.
for me. I'm just going to tell me when you can see my fingers wiggling.
Right there.
Perfect.
Right there.
Good.
Right there.
All right.
Right there.
All right.
There.
All right, let's swap eyes and do the same thing. Looking dead ahead.
Right there.
Good.
Right there. Right there.
All right. I'm just looking for my fingers.
Right there. Right there. Right there.
All right, very good. So the visual fields, peripheral vision is good. Next, we're going to do an ophthalmologic, using my ophthalmoscope. We're going to take a look at your eyes. First thing I'm doing is I'm looking at your eyes. I'm seeing that they do have perla. The pupils are equal, round. They are looking straight at me is fine. They are reactive to light. Perfect. Follow my finger here. They do accommodate, which is perfect. They are consensual, so if I shine a light in your right eye, the left pupil constricts just like the right one, so they are consensual bilaterally. We're going to do a quick retinal examination, and I'm going to hold your head here just so that I don't make you uncomfortable, and I'm looking with my right eye into your right eye at the retinal artery, the disc, cup, all of the blood vessels back there. Everything looks healthy, and we're going to do the same thing, left eye to your left. Very good. Everything looks good in the retina. You have any questions so far?
No.
Okay. So next is ocular motor, cranial nerve number 3, ocular motor nerve. And this is responsible for the vast majority of your eye movement. It also has something to do with the pupil's response. So we're going to check cranial nerve 3, 4, and 6 at the same time. So this is cranial nerve, watch my finger, don't move your head. Cranial nerve 3, cranial nerve 6, the trigeminal, cranial nerve 3, cranial nerve 4, the trochlear, and by the way, this is not trigeminal, this is abducens, my apologies. So 6 abducens, 3, 4, trochlear, 3, 3. Good. So your eyes are moving with my finger in all possible directions. So that's 3 ocular motor, 4 trochlear, 5 is the trigeminal cranial nerve, and this is responsible for sensation of the face, cheek, and jaw. So I have, I'm going to use the sharp end of my hammer and then the soft end of a Q-tip. Close your eyes, and for pretty much all of these sensory exams, for this one and the ones we're going to do later, you'll have your eyes closed.
Okay.
So anytime I'm sensing, testing this, but for now, just close your eyes and tell me, does this feel soft or sharp?
Soft. Soft. Hard.
Hard or sharp?
Sharp.
Very good.
Soft. Sharp. Sharp.
Perfect. So that's going to be your number 5, trigeminal, abducens. Facial is responsible for movement of your forehead and face. So can you wrinkle your forehead for me? Can you puff out your cheeks? Can you smile and frown? Perfect. All of those seem to be intact. And abducens, facial, and then next we need to do your acoustic, cranial nerve. So we're going to check, we're going to do a whisper test. Go ahead and cover your right ear for me, and I'm going to whisper a word and you just repeat it to me.
Boat.
Perfect. And let's do the same thing on the other side.
Car.
Excellent. Next, we're going to do a Weber test. I'm going to strike my tuning fork, put it on your forehead, and you tell me if you can hear it equally in both ears or more so in one than the other.
Equally.
Perfect. And next, we're going to do a Rin test. I'm going to strike it again and put it on the mastoid bone, and you should be able to hear it for a while. Once that hearing goes away, I'll put it next to your ear, and if you can hear it once I move it from your ear, your bone, and next to your ear, then that's a good sign. So you just let me know. And can you hear it now?
No.
Okay, well, the tuning fork isn't the best tuning fork, so
sorry.
just pretend that you can. Can you hear it now?
Yes.
Okay, and tell me when it goes away.
It's away.
And how about now?
I can hear it.
Perfect. Sorry, this is...
It's okay.
It does the job, but not very well. So can you hear it?
No.
Okay, let's try again. Can you hear it?
Yes.
All right, tell me when you can't hear it anymore.
I can't hear it.
And what about now?
I can hear it.
Perfect. So the reason that you can hear it once I move it from your ear is because bone conduction is much more dense than air conduction. So you will not be able to hear it because that bone muffles it. Then once I remove it, you can hear the vibration in your ear much easier. So that is the acoustic nerve. And then we need to do the glossopharyngeal and vagus nerve. These are cranial nerves number 9 and 10. Glossopharyngeal, what I'm going to have you do is say ah, stick out your tongue, and I'm looking for uvula movement. So here, I'll get a light while we're at it. Go ahead.
Ah.
Perfect. Excellent. I did notice the uvula rise and fall. And then for the vagus nerve, number 10, we would check your gag reflex, which we don't have to do, but in a clinical setting, we would with a tongue depressor. And number 11 is the spinal cranial nerve. And we need to check trapezius and sternocleidomastoid mobility and strength. So shrug your shoulders for me, and then shrug them against my hands. Perfect. And then let me see you turn your head, and then I'll do it against my hand. All right, push my hand. And then can you lift your head up and down? Very good. So full range of motion and strength of your trapezius muscles and your sternocleidomastoids. So that's number 11. Number 12 is the hypoglossal, which controls tongue movement and strength. So open your mouth with your tongue relaxed. I'm looking for the tongue to be midline, which it is. Puff out your cheeks and then push your tongue against this cheek. Perfect. You do this one? Good, I can see that. I can feel your tongue push my hand against your cheek, which shows that it has some strength. And we could also use a tongue depressor to hold the tongue down and ask you to move against it. So those are your 12 cranial nerves. Everything appears healthy. Any questions?
No.
Okay. Next, we're gonna assess your cerebellum. I've watched you walk into the room and you had a steady gait. We'll assess it again. Do you mind standing here for me? And I'm just going to check to see if the camera, here I can do it from here. Okay, so I'm right here. So go ahead and take a few steps. Perfect, your gait is steady. Now turn around and we're going to do what's called a tandem walk. Keep your feet together and just like this, put one toe, just like that, one heel in front of the toe and walk back to where you came. Good. Turn around again and try to walk on the heels of your toes like this, or the heels of your feet, please. Excellent. And then turn around again and try to walk on your toes. All right, so everything seems nice and steady. Next we're going to do, I'm just checking to make sure that we're all in the picture here. So next we'll do the Romberg test, and put your feet kind of together. Yep, just like that. Hold your hands out like this in a supinate position. And then close your eyes for about 10 seconds. Try to hold your hands a little bit more forward for me. Go ahead and open your eyes for me. Like this.
Oh, sorry.
Like this. Perfect. Now close your eyes. Excellent. Just a little bit of sway is perfectly normal. A little bit of tremble is perfectly fine. Keep your eyes closed a little. I'm just going to put a little bit of pressure. And this is one way to check for pronator drift. I'm noticing that your hands are not pronating downwards. They are staying in the supinate position. So the cerebellum seems fine. Go ahead and have a seat. You can open your eyes now. So all that seems good. Next we need to check for your sensory motors. We need to do a sensory motor assessment. I have one thing to do is a 2-point prong test. And I'm going to have you close your eyes, and I have a 2-point paperclip here. And I'm going to alternate between touching your skin with 1 and 2. Can you feel the difference?
Mm-hmm.
There's 1, there's 2. And we're going to do this on your fingertips, your toes, and your extremities.
Okay.
Let me just fix this just a hair. All right, so go ahead and close your eyes. Hold your, like that. Is that 1 or 2?
2.
Okay. 1 or 2?
1.
Do you feel 1 or 2 pins?
2.
Good.
Oh.
How about 1 or 2 pins?
1. 2. 2. 1. 1. 2. 1.
Very good. We would also do this to all 10 toes.
1.
Okay. We would all do, it's fine. We would also do that for all 10 tones, but both sides. Keep your eyes closed for me. You can relax your arms if you want. Do you feel 1 or 2?
1, 2,
And then on the thigh,
2,
lower extremity,
1,
back of the hand.
2.
Very good. And we would do both of these just for rubric purposes. Do you feel 1 or 2?
1,
We'll use both left and right.
2, 1, 1, 2.
Very good. Perfect. All of those were correct. Next, you've already done so well. We're going to go ahead and do it with a soft or sharp. I'll only use 1 point. We're not going to poke you with 2 anymore. So you just tell me if it's a sharp or dull or soft, okay?
Okay.
Close your eyes for me. We've already checked the phase.
Soft. Soft. Sharp. Soft. Sharp. Soft.
All right. Are you able to extend your legs for me? Thank you, ma'am.
Sharp. Soft. Sharp. Soft. Soft. Soft.
Perfect. All right. So all of that appears to be intact. Next, for your sensory, we're going to do a vibration test and also a position sensory test. Close your eyes again. Keep your feet up here. Are you able to sit like that comfortably, or is it uncomfortable?
No, it's okay.
All right. I'm just checking again to make sure that you're in view here. Okay, just barely. Perfect. So close your eyes. I'm going to bend your toe up or down, and you just tell me if it's upward or downward, okay?
Up. Down. Down. Up. Down. Up. Down. 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 Up.
Perfect. We'll do the same thing for the fingers.
Up. Up. Down. Down. Up. Up. Down. Down. Up. Down.
Very good. So your position sensory of your extremities and digits are all intact. Next, we're going to do a vibration sense test. It's going to be difficult because, again, my tuning fork is a learner's tuning fork. But I'm going to strike it, and you tell me, and then I'm going to put it on the bone of your toes and fingers, and you tell me if you feel vibration or not.
Oh, okay. I need to close my eyes.
You should, but for
Okay.
the sake of testing and for display purposes for my instructor, they're all vibrating. You may not be able to tell it because, again, it's just not great. Feel vibration?
Mm-hmm. I feel vibration.
All right, and we would do that for all 10 toes, and we can also do this for the tips of the fingers. We would check for vibration sense just like this. Okay?
Mm-hmm.
And also in this hand. All right. So I believe that just about covers most of our sensory. There's one other thing. It's called graphesthesia. I'm going to draw a letter in your palm, and you tell me what it is.
Okay.
Let me see your palm. Close your eyes for me. And this is a letter.
A.
Perfect. And next I'm going to do a number.
7.
Excellent. So that was all intact. We would do this to this side as well. Here's a letter.
O.
Perfect. And a number.
1.
Excellent. So graphesthesia is intact, both hands. And I believe that's it for our sensory assessment. Next, we're going to need to do a strength range of motion test for all of your extremities. We've already did your ambulation, so let's start with hand grasps. Go ahead and grab my hand, squeeze as hard as you can. Excellent. You can keep your eyes open for this. And then give me your fingertips like this. Let's just check the strength of your fingers. Perfect. And then push your wrist up against my hand. Great. Same thing. And then downward. Down. All right. Let's check your deltoids. Go ahead and push, raise your shoulder up just like so. And then push against me. Good. Same thing here. Push. Excellent. Let's check your bicep. Go ahead and curl your arm. Excellent. Go ahead and curl it and now bring it back down. Perfect. Curl. And then there we go. All right, so range of motion of the upper extremities is full with no limitations. They appear strong as well. Go ahead and lay back on the bed for me if you would. All right, perfect. Push the gas pedal, push down. Same thing. Now bring your foot up. Excellent. Now go ahead and lift this leg off the bed. Actually, I'll let you do it without me. Go ahead. All right, and now push against me. Great. See how far you can lift this up. And now push against me. All right. Next, I want you to push your legs, abduct your hip, abduct. Excellent. Same thing. And now leave it out there and now come back. Good. Leave it out, come back. Adduct him. Perfect. So, upper extremity strength, range of motion. Lower extremity strength, range of motion is good. I do want to check your quads and hamstrings. We checked the calf, gastrocnemius. So, go ahead and push like that. Go ahead and pull your leg in using your hamstring. Good. Against my resist. Go ahead. And now push it out with your quad. Excellent. Do it again. And you're pushing against my hand. All right. Now use your quad to push me away. Perfect. So that's hamstring and quadriceps. So that all seems to be good and intact. Everything seems healthy. The last test that I have for you is we want to check deep tendon reflexes. To do this, I'll have you sit back on the side of the bed for me. And we're going to go ahead and we're going to do the bicep tendon. It's a little hard to do from a bedroom, but I would hit you right here in the antecubital area, just superior to it to elicit this bicep reflex, which you did. And then next we're going to use the tricep, which is just behind the elbow, and we're going to strike here. Perfect. And these deep tendon reflexes were present. We do the same thing over here. This would be easier if your arm was relaxed, but it's hard to do, I know. And then this one, relax your arm completely. Let me hold up everything. And then there we go. We see that deep tendon reflex. Next, the most common one, come ahead and scoot just a couple inches. And I'm, again, just checking to make sure all of this is visible. Forgive me. All right, looks good. Then we have deep tendon reflex right here, the patellar. Perfect. Perfect. All right, go ahead and lay down for me. Oh, I'm sorry, come back, I apologize. Next, we need to check your Achilles tendon. And those are located right back here over the Achilles. Go ahead and lay down for me. We're going to do a Babinski sign. So the Babinski sign, I'm just run this up your toes. It might tickle a little bit. Is it tickle?
Yeah.
That's okay. But I do not see fanning of the toes, which is normal, which is a good finding. Abnormal finding would be with the toes fan out. It is present in infants and babies, I think up to 24 months, but that would exclude you. But everything seems healthy. I'm sorry about your headache. We'll see what we can do about that. We'll do some planning together. But your neurologic exam seems normal. You've denied trauma. No loss of consciousness, correct?
Correct.
You're not experiencing any dizziness?
No.
All right. No new medications?
No.
Okay. No illicit drug use, recreational drug use?
No.
Do you drink alcohol?
No.
Okay. No tobacco use?
No.
You're not pregnant?
No.
All right. Are you sensitive to light?
No.
Okay, Good. So no sensitivity. All right. Well, thank you so much, Miss Barney. Just for the camera, because I've looked at my watch, I'm just showing the app that I was using. No, this is the, just because I don't want it to be suspicious. All right. Thank you so much for your time.